we know that 1 cubic centimeter of inflammation creates 1% deactivation of the muscles. Well, one of the things as physical therapists, when we evaluate thousands and thousands of patients, and we're finding that there's these common factors of tightness and weakness, and we address this, and it helps with the alignment, it decreases the inflammation, which we use a lot of icing. We get the patients to use ice. We use different modalities to help get the mobility back to the kneecap and to the two bones. But you want to strengthen that gluteus medius. The clammed exercise is a great exercise. I talk about it in my instant relief book. And the other one is the foam roller to mobilize that really tight tendon along the outside of the thigh. If you don't have a foam roller, we even sometimes get a rolling pin out of the kitchen and get people just to massage that area, and it will be very tender if it's tight and dysfunctional. And the other thing that we love is ice. Just frozen peas, corn kernels, put them inside a pillowcase so you don't get frost on your skin. 10 to 15 minutes every night. Just get in the habit, because if you can cut down that inflammation, you can prevent a lot of the arthritic changes that are going to happen. Because if the joint is swollen, it actually makes the knee weaker. And that's that buckling feeling people feel when they're going down steps. We know that 1 cubic centimeter of inflammation creates 1% deactivation of the muscles, which means the muscles get that much weaker. So if you just have a little bit of swelling, which is usually about 10 centimeters of swelling, that shuts down the muscle by 10% already. So again, ice, 10 to 15 minutes, get in a habit doing it every day after activity. If you've been working out, cycling, gardening, doing something, cleaning the house, like just something that's out of your ordinary, and you're starting to feel your knee get cranky, immediately address that. It's very helpful in getting rid of symptoms and helping the body to restore its mobility.
It may allow you to have increased range of motion, increased ability to move, but the best surgery is the surgery you can avoid. In very severe cases, joint replacements are necessary, and medicine has evolved to a point where that's now available. The important thing for you to understand that putting a new joint in your body, whether it's a knee or a hip, as wonderful as it may be, has serious possible side effects, serious possible complications, and is never as good as the joint you came to this earth with. It's helpful. It may allow you to have increased range of motion, increased ability to move, increased ability to do sports, but the best surgery is the surgery you can avoid. But in cases in where it is necessary, it's a wonderful, wonderful thing to have done. The most important thing about joint replacement surgery that I need to emphasize is that you need to make sure that you have, for example, your leg lengths checked prior to surgery and after surgery. One of the greatest complications of joint replacement surgery invariably is creating greater inequality of leg lengths than before the surgery, and that's why it's so important. So make sure you check your leg lengths before and after.
Well, knee pain is very, very common, especially with women. And we have these curvy hips, and it puts more strain on that knee than typically the male structures. Anybody can get knee pain, and you get knee pain usually if it's not a direct impact, like a skiing injury or a fall or a blow where you blow out your anterior cruciate ligament or fracture. You can actually get a lot of the problems from malalignment. And what that means is certain muscles are not working properly. There's certain muscles that will tend to get tight, and they create a dysfunction on the knee, and there's certain muscles that get weak and also create a dysfunction on the knee. And what we want to do is assess what is actually driving that knee pain, and there's very common factors that we find. I would say the major muscles that affect the knee are the gluteus medius, which is very, very important for any stability in the lower extremity coming from the trunk downward, is that gluteus medius, because its role is very important, especially for women, to keep that thigh from internally rotating, which puts a lot of pressure on the inside knee. It not only puts pressure on the inside knee between the two big bones, but it also changes the alignment of how the kneecap sits in this, what they call the trochlear groove of the thigh bone. So the alignment of the kneecap and the alignment between the lower leg and the upper leg. That gluteus medius is key. The other is the iliotibial band. It's that long, it's a very small muscle up at the hip that has this very long tendon that tends to dominate the position of the thigh. And if that is really tight, that it actually makes the gluteus medius even weaker, because it will internally rotate the thigh even more so, putting that other muscle at a disadvantage. The other muscles that we look at are in the foot and ankle. Typically the anterior tibialis muscle, which comes down the front of the shin. That's very important for stabilizing the foot once your foot hits the ground.